Hi everyone, and welcome to ICATS. So you've recently learned that you're going to join your colleagues from other health professions to form and participate on an interprofessional team. Part of what you'll be learning in these teams are interprofessional communication skills such as the PEER model, which we will be discussing shortly. Use of this model will improve your interactions both with your interprofessional teammates and with your future patients and clients. To give you a bit of background about the PEER model, in 2012, faculty from the UK Colleges of Medicine, Health Sciences, Nursing, Pharmacy, and Communications developed the PEER model for interprofessional communication in response to the need to broaden the scope of health professions education to include the concept of purposefully working together with each other as well as with the patient and their caregiver or caregivers. The PEER model is a tool to enhance communication and relationship development among providers, caregivers, and patients by providing a common language as a component of health professions education. The PEER model will be used at various points within ICATS and serves as a framework for health professionals' communication skills. Let's first quickly review a few foundational ideas. According to the World Health Organization, interprofessional education, or IPE, occurs when students from two or more professions learn about, from, and with each other to enable effective collaboration and improve health outcomes. IPE typically better prepares one to participate in interprofessional collaborative practice, or when multiple health workers from different professional backgrounds work together with patients, families, carers or caregivers, and communities to deliver the highest quality of care or services. Finally, interprofessional team-based care is present when care and services are delivered by work groups such as palliative care teams and rapid response teams. These teams are notable for being intentionally created, relatively small in size, and recognized for their collective identity and shared responsibility. Interprofessional education, collaborative practice, and team-based care rely heavily on the ability of team members to effectively communicate and among team members and with a patient or a caregiver. So there's continued study of just how many people die from medical errors each year. Previous estimates cited by the CDC in 2014 rank medical error as a third leading cause of death in the US. More recent estimates approximate that 5,200 deaths per year are directly due to medical errors, and 108,000 deaths per year result from situations in which a medical error contributed. So the conversation is really ongoing with just, how much morbidity and mortality medical errors contribute to. However, our focus is on the fact that really one death is too many, and of the errors that occur, an estimated 70% of preventable medical errors are a result of ineffective communication. Thus, effective communication among members of the healthcare team is really essential for safety in patient care. Healthcare delivery that is effective, safe, and of high quality is essential, and it requires the collaboration and participation of various members of healthcare teams. The health professionals are often from various disciplines and as such frequently have differing orientations to the approach to healthcare. The PEER model is one effort to break down barriers and really remove silos by providing a common mechanism and language for educating healthcare professionals around the critical focus of communication with each other, their patients, and caregivers. Of note, the PEER model removes the hierarchy and places all members of the healthcare team, patients, and their caregivers on an even level in regard to communication. While hierarchy, responsibility, and accountability continue to be part of a healthcare model, effective healthcare team-patient communication is grounded in the concept that all members of the team should exercise the 5 PEER skills when communicating with each other. So the first of these skills is plain language, which is really just your audience being able to find what they need, understand what they find, and use it to meet their needs the first time they read it or hear it. You're also going to want to keep in mind that what is plain to some may not be plain to others. And the following are some approaches that can help you practice and demonstrate this skill. So things such as avoiding medical and profession-specific jargon, using teach-back techniques to ensure understanding, reviewing medications carefully to identify any possible confusion or non-adherence, offering help with forms and other written documents in a friendly, non-stigmatizing manner, speaking clearly and slowly at a moderate pace, repeating key points, and drawing pictures or using illustrations are all ways to help you communicate with plain language. Another component is engagement. Patient engagement is an option for patients to be informed and engaged partners in their care. And engagement among healthcare providers promotes safe, high-quality healthcare. It includes collaboration. It promotes shared patient care responsibility, and it appreciates the contributions of all members. So the following are also some approaches that can help you practice engagement. With regards to provider-patient specific engagement, you can provide medical records to the patient. You can offer choices in medical care, and you can explain treatment alternatives clearly. With provider-provider specific engagement, this looks like leader inclusiveness, serving as liaisons between the team and constituencies, showing compassion to team members, moving beyond following physician orders and actively contributing to patient care, and also asking intelligent questions. Empathy is also a big part of the PEER model, and empathy is just the action of understanding, being aware of, sensitive to, and vicariously experiencing the feelings, thoughts, and the experiences of others. Empathy is a cognitive attribute involving the ability to understand the patient's perspective and a capability to communicate this understanding. Some behaviors that can help you demonstrate empathy are allowing the patient or colleague to express emotions like fear or anxiety. Although you may not have had the same experience that is causing them that fear or anxiety, you've most likely experienced those things yourself. Other behaviors are indicating your empathy with verbal and nonverbal cues like positive nods, a touch if culturally appropriate, eye contact. There's also things like encouraging descriptive narrative conversations rather than simple recitations of facts and symptoms. And finally, really just trying to put yourself in the shoes of your patient or your colleague. Empowerment is another crucial part of the PEER model, and empowerment really means patients having choice, control, and responsibility for treatment decision-making. Empowerment can also speak to community empowerment, which is the process of gaining influence over conditions that matter to people, sharing neighborhoods, workplaces, experiences, or concerns. The following are some behaviors that also help you facilitate empowerment. So building confidence through support and information sharing, encouraging patient and provider participation, providing an atmosphere where one's confidence and competence is highlighted, understanding and acknowledging values and beliefs that are relevant to the provider or patient, identifying and developing strategic plans that include short and long-term goals, and following policies and guidelines. The PEER model also includes respect. Respect in the health professions usually occurs in the context of professionalism, and manifestations of respect can include positive attitudes towards the dignity of an individual, non-judgmental attitudes towards human diversity and uniqueness among patients and colleagues, and support for patient autonomy. The following are also some ways to demonstrate respect. Things like inviting questions and conversation using appropriate body language for the situation or for culture. Understanding and valuing the roles of other healthcare professionals and trusting their training. Remembering that the experiences and knowledge of your patients and their caregivers, as well as your colleagues, are valuable and important, and being sensitive to the human needs of patients and their caregivers. Consider the context of including family routines, religious and cultural practices, things like that. In summary, the PEER model is really a toolbox of evidence-based skills that may be used universally to improve the foundational communication skills of individual providers or healthcare teams. So later with your ICATS team, you will watch a video which depicts a real-life interprofessional team discussing a patient case. While you watch the video, Analyze the provider's verbal and nonverbal communication by using the student activity sheet to record examples of communication from the video that exemplify good use of the PEER model and examples of communication that could be improved. A vocabulary list is provided at the bottom of this sheet for you. However, you shouldn't feel like you need to get bogged down by all the clinical details in this specialized patient case. The video is about 12 minutes in length, but contains several places that are really rich with discussion about what you're seeing and hearing as it applies to the PEER model. This diagram provides a representation of the possible professions associated with the care of cleft lip and palate patients. The highlighted professions are present on UK's cleft palate team and in the video we are about to view. Here's also a diagram of the professionals as they're seated around the table in the video. Finally, the patient being discussed by the healthcare team is an 8th grade boy. This slide depicts a cleft lip and palate patient of approximately that age, just for your reference. So please take note of what you observe while you're watching this video later with your team. After, you will then be better prepared to continue utilizing these skills for another activity. During the second ICATS meeting, you will be practicing PEER again with a standardized patient actor. Thanks so much.